And I want to start by talking about hearing loss. There's different kinds of hearing loss, and there's two kinds of hearing losses called conductive hearing loss or mixed hearing loss, where the inner ear, which is the actual hearing organ, still works quite well. However, the sound never gets to the inner ear because there's a problem with the outer ear or with the middle ear. This is usually, or maybe when there's malformations on the ear, or a situation after middle ear surgery. So these types of hearing losses cannot be aided with conventional hearing aids. And so far, and to appreciate what the bone bridge means for these patients, I want to show you the treatment that has been done so far. And so far, bone-anchored hearing aids have been used. They work effectively. People can hear with them. However, as you can see here, basically what is done, there is a, if you want to say, a screw put through the skin into the skull. And you can see that here. Then you have this, what is called an abutment, which is put on top of it. And then you have this sound processor, which is connected, which creates a vibration, which through the screw is carried onto the skull. And then the skull carries this vibrational signal to the inner ear, which is embedded in bone. And that means that transcutaneous intact skin technology that has been known with cochlear implant for a long time is now available for this bone conduction stimulation. This is what the implant looks like. This is an outside part, so the system has two components, one that is implanted and one that sits outside, and I can show you how this works. This is the implant. It's implanted under the skin. This is the transducer that then vibrates, which is screwed into the bone. And on the outside, you have the processor. There's a magnet in the implant and a magnet on the outside processor, so it holds on top of the implant. However, the skin here just closes. It's intact skin. And so a microphone picks up the signal. There's some signal processing. There's also a battery, a hearing aid battery in this external processor. And then the signal is transmitted through the intact skin to the implant, and then the implant creates the vibration, and the bone carries the vibration to the inner ear, which sits here in this cochlea. So this is how it works. There's intact skin, and so this is what it looks like on the patient. So you have this processor, which usually is hidden under hair. And so the big step here is that the implant and the transducer are safely embedded under intact skin. So in summary, transcutaneous intact skin technology that has been known with cochlear implants for a long time is now available for bone conduction stimulation. The infection and complication rates will be reduced dramatically, and the innovative technology, together with the state-of-the-art signal processing, leads to very good outcomes and very good user satisfaction. Thank you very much.